Welcome back to MedBytes with DocAJ, where we decode your medical journey bite by bite. Today, we're diving into one of the most confusing and highly debated topics among MBBS students and PG aspirants. MD versus MS versus DNB. Which one is better? Which one should you choose? And what are the real differences? Let's clear the fog and help you make a decision that aligns with your career goals and lifestyle. The basics: what are MD, Mississippi, and DNB? Let's break it down. MD, Doctor of Medicine, a postgraduate degree in non-surgical specialties like medicine, pediatrics, psychiatry, radiology, etc. MS, Master of Surgery, for surgical specialties like general surgery, ortho, ENT, OBGYN. DNB, Diplomate of National Board, awarded by the National Board of Examinations, offered in both medical and surgical branches, mostly in private hospitals. Think of MD MS as the traditional university route, and DNB as the parallel NBE route. But now comes the big question: is one better than the other? Recognition and validity. Let's get this straight: all three, MD, MS, and DNB, are recognized by the NMC and legally equivalent for practice in India. However, MD MS degrees are granted by medical colleges affiliated with universities. DNB is awarded by the National Board and is mostly done in corporate or private hospitals. Earlier, DNB was considered slightly inferior in terms of academic exposure and passing rates, but in 2020, NMC declared DNB equivalent to MD MS for teaching posts too, provided the DNB hospital has more than 500 beds. Difficulty and passing. This is where the difference gets real. DNB has a reputation for being tougher to pass, especially in surgical branches. Why? Voiceover with visuals, fewer teaching hours, less structured academics, centralized national exam with strict evaluators. MD MS programs usually have internal assessments, local faculty, and a slightly more lenient pass rate. But hey, that also means DNB holders are battle-hardened and often better trained in high-volume hospitals. Work environment and exposure. In an MD MS program, you're usually in a government medical college, with structured academics, tutorials, and ward teaching, but infrastructure and patient load may vary. In DNB, you're usually in a private or corporate setup. Think Apollo, Max, Fortis, etc. Pros: advanced equipment, high-end cases, better discipline. Cons: less academic focus, may have limited OPD exposure. Workload can be brutal. In short, it depends on where you land. A DNB in a top-tier hospital can be better than an MD MS in a poorly run college. Career and teaching prospects. Earlier, DNB holders had a hard time getting teaching jobs in medical colleges. But now, with the 2020 guidelines, DNB plus 1-year senior residency is enough to be an assistant professor, just like MD MS. In corporate hospitals, both degrees are seen equally. What matters more is your skills and attitude. For those planning to go abroad, MD MS and DNB are both valid for exams like PLAB and USMLE. But for countries like the UK, what should you choose? Here's the golden rule: choose the seat, not the tag. If you get DNB medicine in a reputed hospital in a metro city versus MD medicine in a remote college with 0 facilities, go for DNB. But if you get MS ortho in a well-known government college, go for it over DNB ortho in a low-volume hospital. Your exposure, mentors, and attitude matter way more than the letters after your name. Also ask yourself, are you ready for academic life, or prefer a more hands-on approach? Do you want a structured program, or can you adapt to a fast-paced private hospital system? There's no one-size-fits-all answer.
At the end of the day, you are not just choosing a degree, you are choosing a journey. So do your research, speak to your seniors, visit the hospitals if possible, and then decide. If this video helped you, don't forget to like, share, and subscribe to MedBytes with DocAJ, and drop your queries on your dream PG branch in the comments below. I personally reply to as many as I can. Until next time, stay curious, stay grounded, and stay true to your calling.